The Local Education and Training Board, as in the LETB, will be the successor organisation for education workforce development. The current Deanery structure sits within the Strategic Health Authority. The Local Education and Training Board, as a system, will be the successor organisation for delivery of workforce development, education and training. LETBs will be provider driven, and I think that's the critical difference. Essentially, the Local Education and Training Board will be representative of all NHS providers across West Midlands. We have a range of providers across obviously acute, community, mental health care, but also the LETB as a system will need to be representative of other providers of NHS care, and those are providers across social care, private, independent and voluntary sector and public health. Now that representation is not necessarily at the Local Education and Training Board level, but it will be at local level, and that's where the training council structure will start to sort of embrace all of those and include all of those providers so that they all have a voice in the education system. There is a drive at the moment to get out to as many of the stakeholders that we would normally engage with, but also to identify stakeholders who may not be particularly engaged in the current system, particularly across private, independent and voluntary sector providers. We are required to move into shadow form from the 1st of April as a Local Education and Training Board. It's an opportunity for us to continue to actively plan and transition the current services into the new structures. Ask questions, read the literature, find out what's happening, ask those questions, visit our microsite. Be aware that this is going to represent a change. You need to be engaged and you need to understand the new system. It's about each locality understanding the needs of its patient population, and the inner city Birmingham patient needs are very different to the more rural Shropshire needs. And again, you as leaders within those localities are best placed to understand the needs of the patients, but also the workforce supply within those areas, which also varies. It's always very difficult within the NHS to get the right level of communication about any change filtered down to, to every level. So I think the first thing is to ensure that we get clear messages out about the system. To some degree, there is a lack of clarity still around the new system. Health Education England is still emergent, so we are working with what we know, but there is an time imperative. We have essentially a year to move this whole operation safely. A significant risk for us is maintaining the sort of talent in the system and ensuring that the best of our staff do not drift off during this sort of period of fairly significant uncertainty. I am incredibly optimistic about the success of it. I don't underestimate the challenge within the system and the challenge of getting this right. But what we've had right from the start and from the original consultation over a year ago is we've had excellent engagement. And I think the thing I found most optimistic is that people are, find immense goods in the current system, but want to maximise the opportunities for change, want to put right what doesn't work in the new system. And I think this will give providers a much greater voice, both locally but nationally as well, to influence the direction for workforce development and workforce planning.